Hello, I'm Dr. Matt Siedhoff, a member of our Advanced Laparoscopy and Pelvic Pain Division. To tell you just a little of my background, I'm originally from the Midwest, but I've spent time on both coasts before finding a home here in North Carolina. I was in California for medical school at Stanford University, and then did my residency training in OBGYN at NYU in New York City. I was fortunate enough to do my fellowship here in Chapel Hill, the 11th fellow to complete the program under the direction of Dr. John Steggy. The fellowship is one of the most well-respected in the country, offering training in advanced laparoscopic surgery and the management of pelvic pain. During my fellowship, I was also able to complete a Master's of Science in Clinical Research, a unique program that draws on the strength of UNC School of Public Health and gave me a good foundation to pursue my research interests. I always knew I wanted to pursue a surgical specialty, and from the very beginning of my residency, I saw OBGYN really as a path to do what I do now. The type of surgery we do fits my personality. It's very detailed and precise, but it also requires creativity because everyone's anatomy is different, sometimes remarkably so. And the focus on pelvic pain appeals to my interest in helping with important quality of life issues for women. Let me explain a little bit more about the kind of surgery we do, laparoscopy. In general, scopic procedures involve attaching a lens to a camera so that we can get a very close-up, magnified view of the area of the body we need to see. Colonoscopy, for example, involves placing a scope in the colon. Cystoscopy looks in the bladder, hysteroscopy looks in the uterus, arthroscopy looks in a joint, while laparoscopy is looking in the abdomen and pelvis. The camera and lens not only give us a very precise view, but also allow us to use tiny incisions to do the operation, which means a faster, less painful recovery for patients and a better cosmetic result. It also makes it less likely that adhesions or internal scar tissue will form. We typically use the belly button for the camera since we all have a natural scar there, and it's in the middle of the abdomen. We then use a few other incisions off to the side to complete the operation. Here on the website, you can see some examples of laparoscopic surgeries that were filmed and presented at national meetings. You may have heard of robotic surgery. Don't worry, that doesn't mean a robot does the surgery. Robotics is just a type of laparoscopy. The same kind of incisions that are used, but the instruments are controlled by the surgeon using something we call a console. We do most of our surgery with conventional laparoscopy, but I find robotics helpful for certain types of procedures that are more delicate or involve a lot of suturing. We do laparoscopic surgery for all sorts of conditions, but the most common are fibroids and endometriosis. Not all pelvic pain is endometriosis, but it can be one source of pain we can help with surgery. Endometriosis is a condition where the lining of the uterus, the part that sheds every month with a period, grows outside the uterus in places it's not supposed to. Sometimes it will be just a little bit here or there, but other times it can cause extensive damage to the ovaries and fallopian tubes and cause things like the intestine to adhere to pelvic organs. Surgery to treat this sort of advanced disease is very challenging because the scar is difficult to separate, and you obviously have to be careful not to damage the organs that are stuck together. Another condition we see frequently is uterine fibroids, sometimes called myomas or leiomyomas. These are benign tumors of the uterus that are very common and most of the time don't cause problems, but occasionally they grow very large or get close to the lining of the uterus and cause heavy or irregular bleeding. The most common surgeries for fibroids are myomectomy and hysterectomy. Myomectomy involves making an incision in the uterus, extracting the fibroid, and then suturing the uterus back together. Hysterectomy involves removing the uterus with the fibroids. Choices about those surgeries, or whether to have surgery at all, involve lots of different factors that are unique to each person. We have a special fibroid care clinic here at UNC where we focus in depth on these issues. There's a lot more information about the Fibroid Care Center and fibroids in general on the website, and I invite you to take a look. I hope this brief introduction gives you a sense for what we do. If any of this is pertinent to your situation, I hope you choose to visit us here at UNC.